Welcome to Venturis, and today we're going to be talking about adipose stem cells and the science and clinical applications as used in our office. What are adipose stem cells? Well, adipose-derived mesenchymal stem cells are multipodal stem cells. They're usually found in your fat tissue. They're harvested in a minimally invasive procedure, and then they are cultivated to promote tissue repair. So they're safe, they're passed through a FDA standardized lab. These clinics are using product, and if you're not careful about where it comes from, how it's screened, one of the things we love about adipose stem cells is that they do screen them for previous cases of long COVID and any other autoimmune diseases, so you get the rich growth factors. And when you combine that with your own cells, such as a PRP gel, you'll see such a good benefit from it. And the science behind stem cells is amazing. It has shown anti-inflammatory properties. It fosters tissue repair and regenerative processes and makes them a great avenue for new innovative treatments that are using adipose stem cells for autoimmune and pain. But why do we use it? Well, adipose is richly available, and it contains a lot of growth factors, and its high yield and rich vascularization is one of the main components. So patients that have chronic joint disease or some sort of arthritis, especially if it's genetic, doing an adipose tissue stem cell mixed with a PRP gel, you have very little immune rejection and risks in patients. Adipose stem cells in pain also help with connective tissue. Primarily at our office, if you're not strengthening things like tendons and ligaments, it will not help alleviate arthritic symptoms because it's all about stabilization at that standpoint, and adipose stem cells help with that. As far as autoimmune conditions, we have seen a big change in patients with autoimmune when this is used as one of the tools. You can reduce chronic inflammation. You can actually get your body to respond and activate mitochondrial response. And it's a really good, promising alternative to traditional therapies that may not work, especially things like immunotherapy and steroids. These stem cells offer a transformative approach because you're targeting the root cause. You're fostering long-term healing. I mean, these effects will go for weeks and months at a time. And when you combine it with other treatments, you'll actually see such a big difference in about 30 days. The safety and research is also the other thing. Its promising effectiveness is supported by a growing body of research validating the safety and clinical applications for patients seeking advanced treatment options. You can go and look at the research, especially coming in from Europe. Adipose stem cells are showing a very good promising result for a variety of different conditions. So who's a candidate? Well, it's ideal for people that are experiencing chronic joint pain, degenerative musculoskeletal conditions, autoimmune related inflammation, and it's promising a regenerative option for those seeking it. And at Venturis, we really emphasize a personalized evaluation to tailor these treatments for you. It's utilizing things like imaging, lab tests, and we just want to get you the best results possible. There's no over promises. We're not a high volume practice. We literally cater towards our patients to make sure that you are taken care of. And that's why you choose us, is we're patient centered all the way across, and we function off of referrals, and we're 25 years in practice, and if there's a new product out there, we're always doing research and conversating with physicians across every platform to see what's best for you guys. You can reach us at venturisclinic@gmail.com. You're more than welcome to set up a phone consultation, send us imaging, send us labs. Our phone number is 405-848-7246. If you're flying in from a different state or country, Will Rogers Airport is centralized and we have hotels close by. You can also follow us on Instagram at Venturis Clinic. We will talk to you soon.